Hello folks, this is a re-recording of the original talk I gave on August 3rd, which was the second installment of The Doctor Is In. I've learned a little bit more about improving the quality of these videos. As you can see, I've still got a lot more to learn, but things are getting better. The blog version of this webinar is available at the link provided in the show notes. So this talk is all about prevention. I'm a pediatrician, so naturally this is one of my favorite topics. One of the most important aspects about human trafficking is that it can be stopped. We can prevent it from happening. It's certainly not easy, but it's not impossible. And what I hope to do here is to give an overview of the public health principles and demonstrate how these principles serve as the foundation for a lot of our work in prevention, but also advocacy and research. Human trafficking is a health issue in that it is devastating to an individual's health, but it's also a public health issue because the impact of the consequences spread far beyond the suffering of the survivor. So several times today I'll cite Jonathan Todres, and I've posted the citation as well as other references in the notes below. Todres has written several articles on this topic, and there are other articles, but this is my go-to paper. And it's interesting to note that Todres is a law professor and not actually a public health professor, but I'm so glad that someone gets it, especially someone who's outside the medical profession. So as a pediatrician, I know about how unglamorous and frankly uncommercial and relatively unattractive prevention projects are. It's not sexy. Pediatricians, at least in the USA, make the least amount of money of any physician specialty, mostly because a lot of our practice is not doing interventions. And we are actually trying to prevent interventions from being necessary. And prevention can be difficult to quantify because the necessary research studies usually take longer and numbers are more difficult to count and analyze, although it is totally possible. Unfortunately, the anti-trafficking movement got started off on emphasizing a law enforcement and aftercare assistance approach. Not that there's anything wrong with those. We need these components. We need to get the bad guys and we need to help survivors. And these problems are a little bit easier to identify, and it's easier to address and then form a plan. And it also makes us feel good when we feel like we've actually done something about this, and it's easier to count. And so we can say, we've rescued these many people and we've prosecuted so many criminals, and I get it. But we're simply not going to arrest or rescue our way out of human trafficking. So this approach, unfortunately, has also formed the framework of the USA State Department's annual TIP report, or Trafficking in Persons report. And this rates countries according to their ability to prosecute, protect, and prevent. Although what comprises a lot of the prevention strategies amounts mainly to awareness campaigns or some training programs, and it hardly gets to the root of the problems. And therefore, the USA, through this report, has unfortunately broadcasted and recommended a rather narrow approach to addressing human trafficking to the rest of the world, and has left us with an underemphasis on prevention. I remember when doing human trafficking was all the rage in international development. And unfortunately, in a rush to do anti-human trafficking work, donors stopped funding and workers stopped doing good old-fashioned community development projects, which are exactly the kinds of things that needed to be kept going in order to keep people out of poverty, prevent vulnerabilities, and therefore help prevent human trafficking. So I am proposing that a public health approach is an excellent way to move upstream and prevent trafficking. Think of other public health initiatives: smoking, seatbelts in cars, driving while intoxicated, etc. Bill Foege, former head of the US CDC, has said that the business of public health is prevention. We need to make what is acceptable and make it unacceptable. So to lay a bit of basic foundation here, there's basically two types of prevention. And the first is primary prevention, which is stopping something from happening in the first place. For example, vaccines, or preventing adverse childhood experiences, and helping vulnerable youth stay in school and in families, preventing child marriages, etc. Secondary prevention is stopping something from recurring. And examples of this include helping someone leave a situation of sexual exploitation, criminal deterrence, and empowering labor inspectors to identify, report, and abolish certain practices. So these examples I'm using throughout the rest of the presentation are a mix of the above, and there's no one right way, and a variety of interventions are usually necessary. So what does a public health approach have to offer in terms of preventing human trafficking? We don't have public health degrees, or at least most of us don't, but I'm sure these concepts will be familiar to you. So a public health approach addresses issues at the individual and the familial and the community and the societal and even larger population-based levels. So it focuses on identifying vulnerabilities that put people at risk for being trafficked. It is grounded in research and can provide evidence to building effective interventions. And hopefully we get to those interventions before the traffickers do, or we get to the people. This approach can help reshape societal beliefs and practices to change the way we see situations. For example, we've moved from the harmful label of child prostitute to at-risk youth or sexually exploited youth. And this then helped change policies and procedures to assist these youth instead of unfairly criminalizing, and it helped the general public see these youth not in these are bad people, but these are people at risk kind of mindset. So a public health approach also relies on networking, communication, and collaboration. There are too many instances where counter-trafficking organizations have taken a scarcity, zero-sum, get our piece of the pie approach. Others have adopted a we know what's best and we don't need to continue learning from others attitude, and that really helps progress. It engages all stakeholders, from survivors to service providers to the communities at large. And finally, a public health approach emphasizes evaluation and monitoring practices that ensure that interventions are effective. Sometimes, however, we won't know if our interventions will work until we start, despite our best preparatory research, and that's okay. That's why we have monitoring to keep track as we're making our project go. So Todris explains that the monitoring and evaluation components enable policymakers and stakeholders to distinguish between whether they are doing something about a problem or doing something effective. Let me say that again. There is a difference between doing something about a problem and doing something effective. So it would be fantastic for donors to insist that programs have demonstrated preliminary research as well as a plan for evaluation and monitoring, and, importantly, fund these efforts and components in their grants. Good examples exist where grassroots organizations have partnered with academic institutions to produce good research about vulnerabilities and interventions. Todris also states that the more governments and communities know about what makes individuals vulnerable, how traffickers operate, and what underlies demand for exploited labor, the better positioned they will be to respond and prevent such exploitation. So what does a public health approach to human trafficking look like? Prevention programs might include the following interventions, and this is not an inclusive list. I'll highlight where healthcare professionals can specifically make a difference. So regarding the individual, healthcare professionals can provide risk-specific resources or interventions, such as intervening to prevent adverse experiences or screening parents for adversity or mental illness. We can ensure that individuals or families have mental health services. We can advocate for resources, and assist people with disabilities, because having a disability is also a high risk for being trafficked. Screen and identify sexually exploited, trafficked youth and adults. We need to address LGBTQ specific risk factors for being exploited. We need to develop an awareness of and skills in identifying and referring possible incidences of organ trafficking in a patient who is in need of one, or caring for someone who has donated an organ on suspicious grounds. The general public can provide life skills training, mentoring, and other forms of support, such as providing access to education, vocational training, employment, and housing. We can teach our children about how to be safe online, and be sure that they will tell a responsible adult if and when they have a bad encounter online. The next level up is a relational level, and that's when we invest in developing strong interpersonal skills. Healthcare professionals, especially pediatricians, can provide anticipatory guidance about healthy sexual relationships. We need to discuss pornography and internet safety with our patients. We should discuss we can provide resources in waiting rooms. We can ensure a safe environment. In general, the public can start learning and teaching about grooming techniques, such as used by lover boys or Romeo pimps in schools, online, and other youth-centric spaces. We need to strengthen families, reduce ACEs. I can say that again and again and again. Advocating peer group interactions, and we can tutor at-risk youth or participate in a Big Brothers Big Sisters kind of program. In the community, such as in schools, neighborhoods, and places of worship, health professionals can train other health professionals at their clinic or hospital about trafficking in persons. We can understand the local situation. Which sectors in our area might be likely to harbor trafficked people? Which organizations are working against human trafficking? We can collaborate with these organizations and perhaps other social workers to synergize our prevention efforts. We need to know how and where to make safe referrals. The general public can raise awareness about the problem. We volunteer with local organizations to help in their locally application prevention efforts, such as health issues, identifying families at risk. Or are there other sources of exploitation, such as recruitment for work or study abroad? The public can also work to counter views, behaviors, and practices that foster demand, or that discriminate against potential victims and survivors. At the societal level, that includes cultural norms as well as political issues. At this level, healthcare professionals can advocate and stop crippling medical debt. And this is a big problem in certain developing countries. We can raise awareness. A lot of times, healthcare professionals are respected in their communities, and when we are standing up for a kind of injustice, people will take notice and get involved. Generally, people can engage on different aspects, such as policies, social, economic reforms, helping migrant agricultural workers with documentation, or empower them to receive their proper wages. We can train our labor inspectors. We can criminalize child marriage. We should be requiring age verification to access porn. We need to challenge the harmlessness of porn. We need to ensure better protection of refugees and asylum seekers. There are some potential limitations and pitfalls to prevention work that we need to be aware of. When an organization or research team sees a problem in a particular way and takes an approach that seems valid in one aspect but is invalidating in another one, for example, when research on the health consequences of sexually exploited women was dominated by studying HIV prevalence and transmission, it portrayed the women as vectors of disease and not as whole persons with more complicated health and social histories. This unwittingly created prejudices and stigmatized the women rather than help us understand their situation and how best to help them. Fortunately, we can learn from our mistakes if we're wise enough to listen. Wood, in her study, said that healthcare professionals are encouraged to have influence, where possible, beyond the care of the individual patients. Research, health insights, advocacy, and promotion of a survivor input enhances the collaborative development of evidence-based approaches to prevention, intervention, and the aftercare of affected children and families. Most of you are not health professionals, but I hope that you can begin to understand just how much healthcare and its various aspects link to your work against human trafficking. Furthermore, a public health approach is quite different from a law enforcement approach. I want to encourage you that you, all of you, each one of you, have something to offer in stopping human trafficking. Join a current project or organization or research. Test your own ideas, evaluate them, scale up if they work. Those of you who are already on the front lines already have a rich resources of information regarding some of the most invisible people on this planet. We can work together to help those who have been affected, and we can work together to help keep people from being caught up in trafficking in this first place. I've given only a very broad overview here, and of course there's a ton more to say about prevention and human trafficking, and I'll be picking up on this topic in future talks for sure. But I want to end with this poem by Emily Dickinson. If I can stop one heart from breaking, I shall not live in vain. If I can ease one life the aching, or cool one pain, or help one fainting robin into his nest again, I shall not live in vain. Emily Dickinson. Thanks all, and please join me for one of my live sessions in which you get to ask me your questions. Bye.